Good morning, friends. Today is a second session, second week. Today we are going to study about muscles and bones. So we have I have collected many royalty-free videos so it will be very interactive and few will explain about the bones and muscles and after the theory parts there is a what are the disorder of the bones. One video will tell you, we can visualize what is happening there. So later, next is we will discuss vibro homeo remedies which will cover this problem. And we'll also, today we are planning to introduce the what are the complaint, what are the muscular bone disorder that we can see in our app. So, and there is a wonderful app today we are going to discuss, that is Select Remedy. It is in the Android and dynamic. Also, we will come to know, means we'll how to search about this complaint covering in our these two apps, and also how easy it is, how difficult it is to go through the homeo vibro system, vibro homeo system. Now here we have, thanks to Swami Mata Narayani, he has done very crisp and clear uh, clear remedies. She has given so clear remedies so that it will affect all our different parts what we are going to study here. Okay, I'll play them. So one by one. Okay, now we will see the videos. That is what explains about the muscles and the bones.
Are you scared by this image? Be comforted by the fact that the skeleton not only provides rigidity and structure to our body, it's essential for the protection of vital organs like the lungs, the heart, and most importantly, the brain. So the skeleton is a vast structure, and in order to make it easier to study, what we do is we break it down into two different parts. So over here, the part that you see in white, that part is called axial skeleton. Axial stands for axis. So this is the central axis of the body, and the axial skeleton is present very close to the axis, hence the name. Now the brown part, the rest of the skeleton, all these parts, they are called appendicular skeleton. Why appendicular? Because our hands and legs, these are appendages. So appendages are things that are attached to the main body, and these appendicular skeletons provide support to our appendages, hence they are called appendicular skeleton. So in this video we will look at different parts of the axial skeleton, and what bones make it up. So let's go to this part first, our skull. So these are two views of our skull, and the one in red, this part is made up of cranial bones. All these cranial bones, they cover the entire head, and they're also present inside the eye sockets. And what about the blue part? These bones, the blue
ਉਹਨੇ ਕਰੀ ਮੇਰੇ ਸਾਲ ਦੇ ਨੰਬਰ ਨਹੀਂ ਭਰਿਆ ਸੀ
ਕਿਤੇ ਭਰਿਆ ਸੀ ਉਹਨਾਂ ਨੇ ਮੈਨੂੰ ਯਾਦ ਭਰਿਆ ਕਿਤੇ
Hello. Yeah, that's nice. I can see.
ਉਹ ਭਾਈ ਗਈ ਰਾਮ ਉਹ ਮੇਰੇ ਹਰ ਸਾਲ ਦੀ ਗੱਡੀ ਕੀਤੀ
Yeah,
ਨਾ
welcome to all.
ਉਹ ਹੁਣ ਮੈਂ ਚਲ ਗਿਆ ਹਾਲਾਂ
All
ਚਲ ਗਿਆ
inside.
Good morning, sir.
Good morning, sir. Good morning. And today we will be studying about muscles and bones. Okay. And we made this as dry subject very interesting now. So I can find some whether you are talking about this from me, with me, or something else. I don't know.
ਪੀਣਾ ਗਰਮ ਹੈ ਗਿਆ
Harsachan ji, please mute yourself. I think you've forgotten to mute your mic.
Okay. Okay, nice. We have, we'll start our subject today. Recording is already started. We will edit and send it to you. It's a common problem with all online tutoring and telling about all these things. Anyway, so today's topic is bones and muscles. So I have made it the very interactive way. First, we'll study about muscles, bones, and we have taken some royalty-free videos. So that you can be explained very in detail about the muscles and bones. But initially you feel it is bored, but you should go through, or you can say at some other time, because most of our participants, they are asking for the recordings only, because many are busy. We already stated that because of busy schedule, people, we will be providing the recording of this session also. But see, if you can see your face, and they tell about it, and discuss about it, that different flavor only. And today, what are the planning? First, we will be playing the videos about the muscles and skeleton and system, musculoskeletal system. So on that, and one more video will be there. What are the disorder of that? And now finally, I have listed what are the remedies, vibro homeo remedies or homeopathic remedies, but we are all doing in the vibronic form only. So we will discuss that. Then how later, how difficult it is to prescribe homeopathic medicine, vibro homeopathic medicine, and how very easy it is by using our Mataji's remedies. And all this we will be discussion of today. And every topic, sometime I will pause it and tell you also, so that if a video is running, we'll say what is the best remedy for this, and what is the remedy, or you can say card number we are using for this particular problem. So we'll tell you in detail. So let us start and make the we'll start the video, so that in between I will because it is a dry subject. Sometimes we say we should make it a theory is always like that. We should always join with a practical. So let us see.
Are you scared by this image? Be comforted by the fact that the skeleton not only provides rigidity and structure to our body, it's essential for the protection of vital organs like the lungs, the heart, and most importantly, the brain. So the skeleton is a vast structure, and in order to make it easier to study what we do, are you scared by this image? Be comforted by the fact that the skeleton not only provides rigidity and structure to our body, it's essential for the protection of vital.
Is it audible, please?
Yes, sir.
Thank you.
Vital organs like the lungs, the heart, and most importantly, the brain. So the skeleton is a vast structure, and in order to make it easier to study, what we do is we break it down into two different parts. So over here, the part that you see in white, that part is called axial. Axial stands for axis. So this is the central axis of the body, and the axial skeleton is present very close to the axis, hence the name. Now the brown part, the rest of the skeleton, all these parts, they are called appendicular skeleton. Why appendicular? Because our hands and legs, these are appendages. So appendages are things that are attached to the main body, and these appendicular skeletons provide support to our appendages. Hence, they are called appendicular skeleton. So in this video, we will look at different parts of the axial skeleton and what bones make it up. So let's go to this part first, our skull. So these are two views of our skull, and The one in red, this part is made up of cranial bones. All these cranial bones, they cover the entire head, and they're also present inside the eye sockets. And what about the blue part? These bones, the blue bones, are called facial bones because, as you can see, they make up the face. Now, other than the cranial bones and the facial bones, the skull has a few more bones. 6 of them are present inside the ear. So this is our external ear, and if you go inside, here is the middle ear, and here are the ear ossicles. So we call them ear ossicles. Ossicles are nothing but small bones. So they are really, really small, as you can see. So what are these bones called? You might have studied them in a lower grade. This bone right here is called the malleus. It's a hammer-shaped bone. And the next bone, this one right here, it's called the shaped bone. And the last one is a stirrup-shaped bone and is called the stapes. The last bone that we're going to talk about in the skull is a bit weird. So as you can see, it is present below the jaw and in front of the throat. So it's called the hyoid. And as you can see, it seems to be hanging in the air. So that's not done by any other bone. They are connected to some or the other bone, but this one is not. Then how does it stay in place? How does it not fall down? That's because even though it's not connected to any bone, it is connected to muscles. And it helps in the movement of the tongue, the movement of the throat, etc. So that's what we have in the skull: the cranial bones, the facial bones, the ear ossicles, and the hyoid. Now let's move over to the vertebral column. So the vertebral column, I'm sure you know, it's our backbone. It's present in the back, of course. And the vertebral column is made up of these small units called the vertebrae. And there are different kinds of vertebrae depending on the level at which they are found. So the vertebrae at the level of the neck, these are called the cervical vertebrae. Cervical in Latin means neck, hence the name. This portion, this entire portion, is the chest region, and these vertebrae are called thoracic vertebrae. Thorax means chest. So there are 7 cervical vertebrae, 12 thoracic vertebrae, and then in this region, the lower back, we have 5 vertebrae, which are called the lumbar vertebrae. 5 in number, and lumbar relates to loin. So loin is the lower abdomen region. So that's what the lumbar vertebrae support. That's why they call it the lumbar vertebrae. And below the lumbar vertebrae, we have this white bone, and this is the sacrum. There is just one vertebra. It's the sacrum.
So we have seen there in that video, there are the cervical, thoracic, and lumbar bones. So for this cervical region, we have OM4, organ medicine 4, OM4. It will, because what are the problem of this cervical vertebrae? Cervical spondylitis, and even we'll see when we study about the nervous system, what are the nerve passing through those cervical region, that also get affected. So for all this, what remedy we use? That is OM4. So next region is the lumbar vertebra. We use OM 18. And OM 31 and 32, they work on the whole spinal cord. So we will see, this is the upper portion of our vertebra. So most of our problem comes through this region. Also, the nerve passing through this cervical will also be cured by that. And we have another remedy called as a back pain. Back pain means generally it covers all the spinal cord. And pain is again the typical topic. Pain is due to what? Whether due to as muscles or a bone, we'll study later. We'll continue this.
In other animals and in our ancestors, they used to be separate vertebrae, but in us, all those separate vertebrae have fused, have joined to form one single vertebra, sacrum, which forms the base of our vertebral column. And the last vertebra is the coccyx. And you might have heard it is also the tailbone. It's also one in number. Again, like in other animals, there are coccygeal vertebrae. There are a few coccygeal vertebrae, separate ones, but in us, they have all been fused together to form one bone. And what does it do?
This particular region, this tailbone coccyx region, there is a specific remedy in the homeopathy that we are going to prepare through our vibronics, that is aciculus. Aciculus is one of the remedy which works on this area. We'll tell you the radionic rate and we supply all those rates and we'll discuss in detail.
In us, it has absolutely no function. We do not have a tail, so in us, it's a vestigial organ. So this is all about the vertebrae. Now, the thoracic vertebrae, they are, as you can see in this picture, connected to the ribs. We come to the ribs. So there are 12 ribs on each side, and each of the ribs are connected to the thoracic vertebrae at the back. So 12 thoracic vertebrae, 12 ribs. And at the front, they are connected to this bone, which is called the sternum. So depending on how they're connected to the sternum, the ribs have different names. Okay, so first let me label the sternum bone. This is the sternum. The first 7 ribs, they are directly connected to the sternum through cartilage, of course. So these white things, they are not the ribs themselves, they are cartilage. But all of these 7 ribs, they are connected separately to the sternum. All of these ribs, they are separate from each other and they are connected to the sternum and are called true ribs. Why? We will see in a second. The next 3 ribs, this, and this, 8th, 9th, and 10th ribs, they are not directly connected to the sternum. Instead, if you notice, they are connected to this cartilage of the 7th rib. All of these ribs, 8th, 9th, and 10th, they are connected to their own cartilage, which join, and they in turn join to the cartilage of the 7th rib, which finally connects to the sternum. So these 3 ribs are not directly connected to the sternum, but through the cartilage of the 7th rib. Hence, they are called false ribs. That doesn't mean the ribs don't carry out their function. They are ribs. It's just a nomenclature that we follow for our own understanding. And the last 2 ribs, as you can see, these 2 ribs, they do not have any cartilage of their own at all. So the 11th and 12th ribs, they don't have any cartilage. They are not connected to the sternum. So they are not connected to the sternum and are called floating ribs. They seem to float, hence are called floating ribs. So to summarize, we have seen that the axial skeleton is made up of the skull, which has the cranial bones, which covers the head, Then the facial bones, which covers the face. Then there are the ear ossicles in the middle ear and the hyoid below the jaw in front of the throat. And then there are the vertebrae in the vertebral column, neck region, cervical vertebrae, chest region, thoracic vertebrae, lower back region, lumbar vertebrae, base of the vertebral column, sacrum, and the tailbone, the coccyx. And then there is the sternum in the front, and then there are these 12 ribs. The first 7 ribs are the true ribs, the 8th, 9th, and 10th ribs are the false ribs, and the last 2 ribs are the floating ribs. And together, the sternum, the ribs, and the vertebrae, they form the rib cage, inside which are housed the lungs and the heart.
Now we have seen the center portion of the skeletal system from the skull to the sacrum. Now we'll see the other part like limbs. So we'll see what are those parts, and we'll see second part of that.
Our arms and legs are our appendages. So the arm and the leg, these are appendages. So the bones that make up these appendages is called appendicular skeleton. So all of these bones, the arms, the legs, and the bones that connect them with the rest of the skeleton is called the appendicular skeleton. So in this video, that's what we are going to look at. You and I together, we will explore how the different bones make up the appendicular skeleton and what they're called. So these are the arm bones and these are the leg bones, and there are quite a few parallels between these two. So that's why I've kept them side by side and we will make comparisons as we go along. So these are the arm bones, and this thing over here, it connects the arm bones with the axial skeleton. You might remember from our previous video that the axial skeleton consists of all the bones that is close to the long axis of our body. So these bones include the rib cage, the vertebrae, the skull, etc. So this part here, it's called the pectoral girdle. So this is the pectoral girdle. Pectoral girdle consists of 2 bones. This one, the long one right here, it's the collarbone, and the scientific name for it is the clavicle.
I would like to say here the right side shoulder pain is covered by the vibrohomeomedicine called as a sanguinaria. Sanguinaria covers the right shoulder pain. So you remember whenever someone says, even we have in our vibronics, we have got a right sided pain and the left sided pain. In a right sided pain, we have got a sanguinaria, which covers this area pain.
And the triangular bone over here, this is present on the back, on the dorsal side, and is called the scapula. The English term for it, the common English term for it is the shoulder blade. Parallel of the pectoral girdle for the leg is the pelvic girdle. So this right here is the pelvic girdle. The word pelvic refers to a basin. It originally means a basin. So the pelvic girdle on both sides, the right and the left, they form a basin-like hollow space inside our body, and hence the name pelvic. Whereas pectoral means chest, and this is very close to the chest, hence the name. So just as the pectoral girdle connects the arm with the axial skeleton, similarly the pelvic girdle connects the leg with the axial skeleton. And what is the bone that the pelvic girdle is made of? It's called the hip bone or the coxal bone. The hip bone is made up of 3 bones which are fused to form the hip bone. We will see shortly the more details of that. Now let's come to the arm. So this is the bone of the upper arm and is called the humerus. And similar to that, our leg has the femur. So that's the thigh bone. Then in the forearm, we have these 2 bones, radius and ulna. So this is radius and this is ulna. Now you can ask me, how can you tell between radius and ulna? So remember, the radius bone always is on the side where the thumb is, whereas ulna is on the opposite side. Similar to the radius and ulna, the portion below the knee has 2 bones. So this is tibia and this is the fibula. Again, the same question. How do you know which is the tibia and which is the fibula? So I remember when I was in 11th grade, my teacher told me that the bone that looks more feeble, so this is thin and feeble compared to this bone, that feeble bone is fibula. Now there is an extra bone over here in the leg which is not there in the arm, which is this rounded bone over here, and it's the kneecap called the patella. There is no such bone in the arm. Now let's come to the hand and the foot. Again, the bones that are there are very similar. So the bones that are there in the wrist are called carpals. And there are 8 of them.
There is one interesting thing that is what I was looking. That complete dynamic software. In that software, we can even name each bone part. I just tried by searching the radius bone. So radius bone, then I find 62 remedies in that. And you can even filter the gradation also. Means in any homeopathic repertory, if you see, there will be 4 gradation. 4th one is, see, frequently indicated, frequently and less frequently indicated, and so very rarely it is found. But symptoms are found while proving those remedy. So in the complete dynamic, that software, we can find each and every bone's affinity towards the homeopathic remedy. And if you, by looking in the structure, if someone says this area, femur bone, I have a problem. You can say this pain is only, I have a pain in the femur bone. You can directly search in that, and you will try to, what are the remedies working for the femur bone, we will be able to see. This exercise we'll do when we are studying about that software at the end. So everything here we can see, we will be able to find in our complete dynamic software. Also, these are available in our numerical Mathemedica. Every part is available in numerical Mathemedica. So we can say, if you want to femur, see how organ remedies are generated. What is the concept of organ remedy? If organ is strong, if this particular part is strong, there should not be any disease in that. So similarly, if based on the wherever they have the complaint, or you get you get some people come after all the getting X-ray done or MRI done, showing that they will tell you clearly what is the problem in which bone. So when that is there, you can support that along with their own medication in our vibronic way.
And the bones that are there in the heel, they are called.
Yes, that's one more thing. When I am talking about, when I listen about the heel bone, that is most frequently I am successful in getting the result is plantar fasciitis. They call it plantar fasciitis and calcaneus. They will tell you about it. So there what happens is there will be an extra growth in the bone. Extra growth in the bone can easily be solved with the vibronics. Like using Boni 200, that is a mixture number 3, and Boni, OM Boni in the third number, means OM 3, we can solve this. Also, we have a plantar fasciitis in our numerical mathematica and the calcaneus spur. When we add all these 4 remedies and give, and this is the most troubling complaint in the heels, If you only treat this also, you can make a only plantar fasciitis healing center. You can definitely do. Means that much result we are getting from this. Because I am very confident on this. Within a month, within a 15 days, they get result. So their pain is gone. So sometime it comes back, so you have to again give on that. But result is excellently. We will be able to tackle this with our vibronic remedies.
Sound very similar, carpals and tarsals. Tarsals are 7 though, 1 less than the carpals. Then the palm. The palm is made up of these bones, which are the...
Yes. See, again, when we are talking about these wrist bones and all, what is the remedy? What is the remedy in our vibronics which is working in this area? That's called as hand rheumatism. In our Narayani mixtures, volume 3, we have a hand rheumatism to work in this particular area.
Metacarpals.
These are all mentioned in that.
So the bones right next to the carpals are the metacarpals, and there are 5 of them. 4 for each finger and then 1 for the thumb. So 5 metacarpals. And then corresponding to metacarpals, we have metatarsals in the foot. So metatarsals.
Yes. When what all we see here, that we see that knee joints is there. We will study in the later video that what are the knee joints complaints, how we are going to cover. But here I can see that knee joint. So I am telling. So for knee joint, we have a mixture for the knees, and also for OM remedy for OM remedy, organ remedy for the knees also, which covers synovial fluid, synovial membrane, and the bones, like that. So you see, when you are talking about something, when someone points out that here is a near knee joint, I have a problem. So you are immediately your thought should go to that mixture, knees mixture and OM mixture of the knees, and we'll see. Then if there is an inflammation, we should go for Soham infection 200. So knees, OM knees means it makes all that organ parts strong, and if in mixture knees, it will see if anything wrong in that mixture, it will make it set it right. And if there is an inflammation, you have to use the infection. And if you have a pain, Again, there is a mixture number 59 you can use, or you can say Soham pain, or like if it is due to some injury, you had any past injury to that particular area or anywhere, you can use the injury mix also. So you have to cover up. See, the cause of the particular problem should be covered. So like that, so definitely why one, after taking remedy, one doesn't get all right when it doesn't get cured. Why? Either the remedy is wrong, the remedy what is required for that person you are not added. Means if you add more remedy in Biblionics is not at all a problem. If you don't add that particular remedy which is required for that time you won't get cured. And you should see what else I have left, what else I have not covered in this. Like that you have to add that, and definitely for that we use in our further this one we can use our pendulum and Laker antenna, how to decide or what potency, we will all see that. And we have our new machine. Tomorrow I am going to introduce to you. That's I have named it as a Manoratha. Manoratha means our Manoratha, mind's vehicle. So our to fill the intention in the water or pills, we need Manoratha. We'll talk about it tomorrow.
Again, there are 5 of them. So in the hand, after the palm, we have the fingers, right? So the fingers are made up of these little bones called phalanges. So each of...
Yeah. Now we are listening about the fingers. Finger joint pain. Finger joint pain in the vibro-homeopathic system is a colchicum. Colchicum is a remedy for this finger joint pain. So while going through this lesson itself, we will be able to identify if this is this one problem, where we look into.
These bones are phalanges. How many of them are there? So each finger has 3 phalanges and the thumb has 2 phalanges. So 4 fingers times 3, 12, plus 2, 14. So there are 14 phalanges. And the corresponding bones in the foot are called the same, phalanges again. And once again, there are 14 of them. So these were all the bones in the arms and the legs. Now let's look more closely at the pectoral girdle and the pelvic.
While referring to this, I like to tell you one more beautiful things, because we can see there is similarity in between the hand and the legs. See, and the upper portion of that bone, here also it is one, and femoral bone also, humerus and femur are only one. Then below that, radius and ulna are 2 bones. Here tibia and the fibula are the 2 bones here. So when future will be tackling, means we are studying about the acupuncture method also. See, it is exactly the same, but in a tan balance, what we do? Tan balance we do the opposite way. Means exactly same place in the opposite way. If suppose somebody has got a wrist pain here, so we have to see the opposite side of the same structure of the bone, where we can find the icy points, that is painful points. Just tell them to pressure, or you put oil and massage, you will see that particular areas pain will go off. Here we don't consider any this therapy, that therapy. Every therapy which is drugless therapy, which we can do it on not giving any medicinal substance or anything like that, we will accept it as in our drugless therapy foundation. So here these bones, why I am telling, because very similar structure. So on that, if it is the wrist has got a problem, see in the ankle also we will get the opposite side of the ankle, we will be able to find some painful points, and if we massage it, it is going to affect the wrist area.
So first, the pectoral girdle. So this is the collarbone or the clavicle. So this is the collarbone. And the collarbone is connected to the scapula, the triangular bone.
This collarbone is the most sensitive bone, most brittle bone. Generally, any slightest accident, first it is going to break. It is general.
And this part of the scapula is the one that connects through a joint to the collarbone, as you can see. And this is called the acromion. Then you see this curved edge of the scapula. This is called the glenoid cavity. This is where the end of the humerus, the upper arm bone, fits. Now let's move on to the pelvic girdle, the details of it. So, as I told you earlier, the pelvic girdle has only one bone on each side. So this whole bone, this is called the hip bone or the coxal bone. The hip bone originally had 3 bones which got fused. It has 3 parts to it which are actually fused to each other. So this part here, this is called the ilium. Then this part here, the second part, is the ischium. And the smallest one right here at the end is the pubis. The 2 hip bones on either side, they join over here through a cartilage, and this cartilage is called pubic symphysis. Just like the glenoid cavity in the pectoral girdle, there is a depression in the pelvic girdle into which the head of the femur fits. So this depression is called the acetabulum. To summarize, the appendicular skeleton consists of the arm bones, the leg bones, the pectoral girdle, and the pelvic girdle. The pectoral girdle has the collarbone or the clavicle, the scapula, then the scapula has the...
As I already told you, all these parts are available in the complete dynamic, and it should be, you should take the symptoms of the person also, and by taking into the whether he is sensitive to hot, cold, or everything we can take, and at the final we get a set of remedies working in that particular region. So we have to again filter, use the just take in it's a mechanical process, take a common thing and common in their symptoms and common on that areas, whatever the remedy is working in that area, then whatever matches that remedy we can declare it as a most suitable for that particular area or particular symptoms and particular organ, or you can say bone piece, particularly that area it will work.
Part called the acromion, which connects to the collarbone. There is this glenoid cavity at the end of the scapula, which connects to the top of the humerus. This is the humerus, the upper arm bone. Then there is the radius on the forearm, on the side of the thumb, the ulna, the other bone on the forearm. Then the wrist bones are the carpals, the palm bones are the metacarpals, finger bones are the phalanges. Then in the pelvic girdle, we have the hip bone, and 2 hip bones are joined by the pubic symphysis. Then in the leg, we have the femur, the thigh bone, the kneecap, the patella, the tibia, the stronger bone in the lower leg, and fibula, the weaker bone. Then the ankle has tarsals, the sole has metatarsals, and the fingers of the feet have phalanges.
Okay, now the
meeting point of 2 or more bones is...
Now we will study about the joints, because very important, because they all basically wherever there is a movement, that point only generally restricts us moving when it is getting diseased. When it get affected, or you can say we are not able to move that particular joint, then only problem comes. So it is very important to know the joints of the bones, so how they are working. So for that, what remedies we have, we'll look into it.
On the joint. We have over 300 joints in the human body. I'd like you to pause for a moment and try to identify a few joints on the skeleton here. Well, I'm sure you found quite a few joints. We'll discuss a few of them. At the elbow, we have 3 bones meeting, and that is a joint. At the shoulder, we have bones meeting. That also qualifies as a joint. Even at the jaw, there are bones meeting. That qualifies as a joint too. At the vertebrae, if you look at the backbone, bones are meeting each other there. So that's also a joint. There are lots more. You can pause and try to identify a few more if you like. Now, the joints of the human body are divided into 2 types, the immovable joints and the movable joints. An example of an immovable joint is the joint at the bones of the skull. These bones are not allowed to slide over each other, or they're not allowed to move over each other. They act like a web. Because of that, there's no movement, and that's why they're called immovable joints. On the other hand, we have movable joints. For example, elbows and our knees and our fingers, we have lots of different joints where there's room for movement. And in this video, we'll be discussing movable joints in more detail. Now, there are lots of types of movable joints. We'll discuss 3 of them in this video. The hinge joint, the ball and socket joint, and the gliding joint. Let's start with the hinge joint. I'm sure you've seen hinges at doors and windows. Hinges are pretty interesting. They allow movement along this direction, right? They allow rotation along that direction. Let's try to see an animation of a hinge in action. So you can see that this is allowed to move in this direction and is allowed to move back in that direction. So there's a rotation in a particular direction. We have bones in the body which are joined in a similar fashion. Let's look at one example. At the elbow, we have such an example. Let's see this in action. Look at this arm. At this point, there's a hinge joint. This allows movement in this direction and back in this direction, right? Just like the animation. So that was an example of a hinge joint. Now let's go to the ball and socket joint. The ball and socket joint has 2 components, the ball and the socket. The ball can snugly fit into the bowl-shaped socket like this. And once it fits in, you can see that it can move in the left-right direction, we can call it, or it can move in this direction, right, which is the back and the front direction, if you want to call it. And now you can see it also can rotate around. Basically, it's just free to move within the socket. Can you think of any of the joints on your body that act like this? Well, you may have gotten it right. The joint at the shoulder is a ball and socket joint. Can you spot the ball here? Right. Yes, that's the ball, and the socket is there. Another example is the hip joint. This also has a ball and socket feature. The ball is here, and it sits inside the socket. Let's see this in action. So there's left and right movement at the hip, right? The hip is the point of movement, okay? And there's also front and back movement, right? Front and back movement. Nice. Now we'll come back to a demonstration with both of those movements together. Rotation kind of movement. Okay, so that was the ball and socket joint in action. Now let's discuss the next kind of joint called the gliding joint. The gliding joint is also called a planar joint, and that's because these 2 surfaces, like this say is bone 1 and this say is bone 2, both these surfaces have a plain smooth surface. Okay, you can see how that works. They share a surface and they can move front and back, right, in this direction. But they can also move in this direction. So that's both left, right, and front, back, and a combination of both. But wait a minute, how is it different from the ball and socket joint? Notice that these surfaces are planar. So there's no rotation involved. There's only gliding involved, and that's why it's called a gliding joint. Okay, that's how the gliding joint works. Where do you find it on the body? The best example of a pure gliding joint is the vertebrae. All these string of bones on the back are separated by joints, like here you can see it here. And these are the best example for flat planar gliding joints. That's it for this video. Let's just do a quick recap. So this was our hinge joint. An example of where the hinge joint is found is the elbow. This was the ball and socket joint. An example of the ball and socket joint was the hip and the shoulder. And we've had planar or gliding joints. And the best example that we can find of that is the vertebrae.
Now, we have seen about different type of joints, and mainly what are involved in the joints? Bone has to be perfect, and muscles around the bone and ligaments around the bone should be perfect. So we have to see if we are to treat a particular person, particular place or knee joint. So what all you have to cover up? You have to cover up and what are the disorders of that we will see in next video. Means disorders of the joints and even muscles. And then we will be able to, because I just got this book so that we can follow where it can be applied by going through these videos.
Joints in the human body.
Hi everyone, this is Leah, your lead course instructor for Advanced E-Clinical Training. As I know you've all been following along now with our anatomy and physiology lessons. And so today we are going to go over the musculoskeletal system. Consists of the skeleton, muscles, cartilage, tendons, ligaments, joints, and other connective tissues. And again, these are all part of the musculoskeletal system, and all of these.
Some of the topics will be repetition, but this particular video is well in depth, so we'll be able to grasp that particular knowledge very easily.
Components work together to provide your body with support, protection, and movement. So some functions of the musculoskeletal system include the bones of the skeletal system help to protect the body's internal organs and support the weight of the body. And it serves as the main storage system for calcium and phosphorus. And then the muscles of the muscular system keep bones in place. They assist with movement by contracting and pulling on the bones. To allow motion, bones are connected by joints, which are connected to other bones and muscle fibers via connective tissues such as the tendons and ligaments. And also cartilage prevents the bone ends from rubbing directly on each other. So the musculoskeletal system is actually subdivided into two subdivisions, the skeletal system, and then there's the muscular system. So the skeletal system and protect the organs, and then the bone and cartilage, tendons, joints, ligaments, and other connective tissues compose of the skeletal system. And then you have the muscular system, and this is an organ system consisting of skeletal muscle, smooth muscle, and cardiac muscle. And the muscular system permits movement of the body, maintains your posture, and helps to circulate blood through the body as well. We are going to first begin by talking about the skeletal system. So the skeleton makes up about 20% of a person's entire body weight. And an adult skeleton contains 206 bones, and there are also some definite differences between the male and the female skeleton. Obviously, the male skeleton is usually longer and it has a higher bone density or bone mass. And then the female skeleton, on the other hand, has a broader pelvis to accommodate for pregnancy and childbirth. And the skeletal system is then further broken down into two parts known as the axial skeleton and the appendicular skeleton. So we'll start first by talking about the axial skeleton. As you can see here, that the adult axial skeleton consists of
we have already studied this axial skeletal system, that is the whatever from the skull to the sacral bone we have studied already. So we will only see the important parts. There are some more matter is added into this lesson. So I'm just using this. We'll skip wherever we find it is a repetition.
It's made up mostly of the bones that form the vertebral diagram. There are 8 bones, and these are all of the fish. The auditory ossicles, and the auditory ossicles are 6 smaller bones found within the inner ear canal. And
we have studied this because in the ear there are 3 bones. We have already studied this.
Structures of the inner ear, otherwise known as the hammer diagram. 1 and 3 on the right, and then 3 on the left. The oid bone is the only one located at the anterior of the neck, or the front of the neck. The hyoid one at the helping. So and instead it is connected to neighboring bones by muscular and ligamentous attachments. We have the vertebral column, or the spine. The vertebral column is made up of 26 bones. The first 24 are all vertebrae.
Here, very well, neatly there it is displayed. As I told you, you can go in the OM remedies. Is clearly mentioned from 31 to 34. They are all spine remedies. Yeah, 31 to 34, all are spine remedies. So you can say all this works on the spinal system. So 31 is on the lumbar nerve, sacral nerve, and lumbar disc. 31. And 32 is the dorsal region. Dorsal region from the below the cervical to the lumbar area. And sensory nerve, dorsal vertebra, and motor neuron, they all, I told when we are going to study the nervous system, we will see what are the nerve passing through the different vertebra and controlling what are the activities of the human body. So there is a system called as osteopathy. Osteopathy means their main theme is our bone will be misaligned. Due to that, we get different diseases. So that they align a bone and they assume and they cure the disease is called as a osteopathy. And there are so many things, we have to see that since we are a drugless therapy practitioner, we should see what all faculties are available and how we can identify the problem and how we can be able to solve those problems. Okay, now dorsal region, OM32 works on the dorsal region. And main 33 is a brain stem. Here what all the things it is covering? Total brain. Cerebral cortex, thalamus, cerebellum, spinal cord, fourth ventricle, midbrain, and other things. This is virtually brainstem should be used along with a background remedy for all spinal injury, including lumbar puncture. Means because brain is a master which controls everything, so you have to use OM33 in all the complaints. So like that, OM31 to 33 is all covered in the all spinal cord system. And another thing, along with that, we need the connective tissues also. See, OM30 is a connective tissue. Connective tissue, in that what all we get? Collagen. We have seen recent collagen is a binding between the organs and connective tissue. Restores connective tissues and fibers, bring back to structural and functional integrity. Connective tissues are very important. The same way, the supportive tissues. In supportive tissues, what are there? See, cartilage, connective tissue, ligament and muscle. See, if you are thinking about what I told earlier, you want to treat the knees, knee pain, knee problem. So already I said go to the mixture number 40 as a knees. Then OM knees you have to add organ knees, so that all the parts of that knees will be taken care. And what all there around that knees? That is ligament, connective tissues and muscle, cartilage. So you have to give the OM27 and another, that is the connective tissue OM30 and that particular OM knees. Or you can see if a backbone, a spinal cord, if you want to address, that time what you have to do? Use that all OM31 to 34. Also you use the connective tissue OM30 and OM27 that you use as the supportive tissue. So altogether you will be able to make it very strong. Okay. So we are, in Vibronics, we were able to tackle this spinal system very excellently. Very beautifully we will be able to address this, and results are more than 70%. So you have to take it, because you are not gone through or you are not applied those remedies into that category. For that reason, I am doing this. I am doing this in 1995. 95 onwards, I am with a Vibronic machine. So I know how those works. Okay. So have confidence. If in any case you have any problem, you can consult me. The best way is you should use this drugless therapy system, and heal the people without any side effect. Okay. Now we are listening about the spinal system.
Followed by the sacrum and the coccyx, otherwise known as the tailbone.
Okay, so we have already covered this. We'll skip so that what else we can see.
We have the thoracic cage, or the thoracic cavity.
Yes, we have studied it into the deep.
Next, we're going to discuss skeleton, 20 the axial head, and it's made. Each of these, you have the upper limbs or the arms.
Yes, we have studied this.
Articular skeleton. Now you have the pelvic girdle, and so continuing on with the appendicular skeleton, you have the lower limbs or your legs. You have the tibia, the leg, lower leg. That's the bones that make up bones in the skeletal system. Whether they're the axial bones or the appendicular skeleton can be classified as either a long bone, which help to facilitate movement and support the weight of the body. And these long bones include the major bones of the arms and the legs, such as the humerus and the femur and the tibia, the fibula, and the radius and the ulnar. And then we have short bones, and these short bones help to provide stability and movement within the ankle and the wrist joint. So they provide little to no movement, but these short bones are kind of shaped like cubes and are kind of like as long.
This all I will be giving you, so that you can separately you can see this also.
The medical flat bones, and the primary purpose too. Also, the skeletal system, it's important to understand that the bones can be kept.
This was not covered in our previous video. For that reason, so what is it? There are the two types of bone, cortical bone and the spongy bone. What are the different functions of it? We'll see. So, spongy bone especially it's all, it is inside we get all bone marrow. From there we get a blood produced. So even bone marrow transplant and all does, where it is done here only. And in that we have, this was not covered in the previous. Anyway, I will tell you the which OM remedies will work on this. See, there is a OM blood. OM blood, what are there in that? OM blood is blood and hemoglobin, platelets, red bone marrow and spleen. Those are all working on the production of blood is working. So even bone marrow is also very important here to produce the blood cells. And because there they will produce the stem cells. From stem cells, it becomes a different areas and becomes that particular cells.
Categorized as cortical bone or spongy bone. You can see here in this picture that cortical bone is a hard outer layer of the bone. And it's also called compact bone, and it's also much denser than the spongy bone. It forms the hard exterior surface of bones, and it gives the bone its smooth, white, solid appearance. So the compact or the cortical bone part of the bone is right here. Then you have the spongy bone. That spongy part of the bone contains the red blood cells that are used in production of red blood cells, and it helps in storing the yellow bone marrow, which is primarily composed of fat in the medullary cavity, which you can see here.
See, we have seen the one more important, while studying this thing, there is one more important combination, or you can say remedies there in our vibronics, that is OM3. OM3 is a bone irregularity. Any irregularity is a name, but it makes everything irregular about the bone. So what are the contents of that bone irregularity? Means anything concerned with a bone, or you can say decay, or you can say growth of the bone, any dysfunction, I mean disabilities of the bone, we can use the bone irregularity OM3. As I said, I already told you, if in plantar fasciitis, that is the heel pain, it is generally when you sit at one place, then when you start walking, you get a tremendous pain in the heel. For that, there is no cure. People use that orthopedic sleepers, and they inject with some medication. That is the part of some allopathic treatment. But here we can, with our OM3 with a bone irregularity and bone eye 200, we are able to give the relief to the person. Okay. Then what are there in that bone irregularity? Bone itself is there. Parathyroid is there. Periosteum is there. So red marrow, yellow marrow, and white marrow, all are there in that bone irregularity, so that not only it makes the bone all right, it makes the good cells coming out of that marrow. Okay. Injuries, any disorder of the bone anywhere in the body will respond to this. It is written in the description, usage of that OM3. So this is a very important.
Which consists of the periosteum, which is the outer layer that covers all the bones except for the long bones. Then
Yes.
you have the endosteum, which is the
Whatever we have said now, periosteum and everything that is covered in the OM bone eye 3. So it take care of everything.
innermost. There are also different kinds of cells that make up bone, and they're described here. We have osteocytes, and these are cells that are the building blocks of the bone. The osteocytes form the inner matrix of the bone tissue that gives bones their strength. You have the osteoclasts, and the osteoclasts help to maintain the integrity.
See, now the different kinds of cell that make up a bone. So osteocytes, when by as the age progresses, our bone becomes weak. So we will see that in another video it is going to cover what all the defects in that. So that time what you have to do, osteocytes, it is available in our numerical mathematica. You have to go, it means if you want to make that bone strong, if you want to make a new growth of the bone in case of fracture and anything, we can use those things. And see, what is osteoclast are what that they strengthen the integrity and strength of the bone is determined by that. So we have everything in our numerical mathematica you should use, because we are not connected with this, we will not be able to. Why this anatomy and physiology for the spiritual healers? Why it is required? Because we need to focus on that particular subject. We need to think that we are going to heal that particular bone cell. So our clarity of thought, for that reason we need to study anatomy, physiology and everything of every part, and the respiratory system, everything we need to study, because clear visualization. When you get a clear visualization of what you want to help, what you want to heal, for that reason we are using, or we are all learning this as a part of our curriculum. See, these are the osteoblasts, follow the UEV, or these are the type of thing.
Of the bones. It also helps to break down bone and reabsorb it, so that the bones can renew themselves and repair themselves. And then we have osteoblasts, which are sort of like the osteoclasts in terms of the process of maintaining the integrity and strength of the bone, except osteoblasts build new remodeled bones by producing collagen, so that the osteocyte can remain healthy and in good functioning condition. And then you have the stem cells of the bone, also known as osteogenic cells, and these cells help to form the inner surface of the bone. They are immature osteoblasts that will later transform or mature into osteoblasts. Skeletal system, as we discussed way in the beginning of this lesson. So cartilage is a flexible connective tissue composed of specialized cells called chondrocytes, collagen fibers, and elastic fibers. Cartilage is classified into two main compositions. First, you have.
See, here we can refer to the OM16 knees. You all know that organ remedy. Organ remedy means if organ is healthy, and there will not be any problem, there will not be any disease. To make that organ strong, what all we are using here? In organ 16 knees, synovial fluid, synovial membrane and cartilage. What you are seeing in this picture is covered in the OM16 knees. Okay, so if you add more than one remedy, there is not at all a problem. But you should cover whatever the complaint is.
Hyaline cartilage, which is composed of type 2 collagen, and it also gives the cartilage its glossy appearance. And that's typically found in the nose, the larynx, the trachea, and the ribs. And then you have elastic cartilage that's like hyaline cartilage, but contains more elastic fibers to help move and contract more, and it's found in structures such as the ear, the auditory tube, and the epiglottis. And then you have fibrocartilage, and that's composed of lots of collagen fibers. And examples of fibrocartilage include the intervertebral discs, the pubic symphysis, and other symphysis throughout the body. But here in this picture, this is a picture of this would be the femur, and this would be the tibia, and then here's the fibula. So this would be the knee, and you can see the cartilage where it's showing it where it would be here in the knee.
So see here all that hyaline cartilage and elastic cartilage and fibrocartilage, these are all there in our numerical geometry medica. So to make that particular strong, what is the function of that? If that is not functioning in that way, if there is no any there is no any flexibility, or you can say there is some rigidity is there in that particular cartilage, you can think of this.
Continuing
It is there, page number 99.
Skeletal system, we have as part of the system joints, and each bone of the muscular system is connected to one or more bones via the joint. So
See here, synovial joint, fibrous joint, and cartilaginous joints. They are all covered under the OM knees, OM 16. That is OM knees. It is covered. So they did it, and even I told you as it is supportive tissue, connective tissue, and OM knees. If you cover, this will cover all these points.
joints help motions be subskeletal system include ligaments, and ligaments connect bones to bones at the point where they articulate or move and are near each other. So
this is covered under OM 27. OM 27 supportive tissue. So when you are covering the OM 16 with knees, you have to give this also, so that whole thing you are addressing. OM 16 also has got a cartilage, synovial membrane, and synovial fluid, and in supportive tissues.
here in this picture, you can see this tendon right here. I'm sorry, you can see this ligament right here. So this ligament is connecting bone to bone. And then you have the tendons. The tendons are connective tissues with collagen that connect bones to muscles. So you can see the tendon here. Here's the muscle. The tendon's connecting it to the patella or the knee bone that's right here.
See, this is what is ligament, bone to bone connection is called as a ligament, and muscle to bone is called as a tendon. So,
and then there's something known as fascia, which is also made of connective tissue that can actually connect muscles to other muscles. And although fascia,
yeah, fascia is that it connects. It is also a connective tissue, connects from one muscles to another muscle. So generally, pain and all that generated that occurs in this type of joints only. We will see in when we study the there is a system called frequency specific microcurrent therapy. We will see then how it can be done through vibronics. We'll study in future.
is really technically part of the tendons. So moving on to the second subdivision of this musculoskeletal system, we just finished up talking about the skeletal system. Now we're going to talk about the muscular system. So the muscular system is responsible for the movement of the human body attached to The bones of the skeletal system are about 700 main muscles that make up roughly half of a person's body weight. Muscles are known as either voluntary or involuntary and are also found in the heart and in the digestive system. So the muscles in the muscular system play several roles, which include voluntary bodily movement with skeletal muscles. We have involuntary actions of the body, the organs with the smooth muscles, such as within the digestive tract. And then you have involuntary contractions and relaxation of the heart with the cardiac muscle. So here you can see that there are different cells that make up different kinds of muscles in the body, which we just previously discussed in the previous slide. The muscular system can be described as having 3 different types of muscles, all of which are anatomically different. So these 3 types of muscles include the cardiac muscle, skeletal muscle, and smooth muscle, or otherwise known as visceral muscle. So the cardiac muscle is only found in the heart, and we'll talk about that here in these next few slides coming up. But I just wanted to show everybody the difference with the cardiac muscles, the smooth or visceral muscle, and the skeletal muscle here. So the cardiac muscle obviously is only found in the myocardium of the heart, and we did talk about this in the cardiovascular anatomy and physiology lesson. And so we know that from that lesson that the cardiac muscle is responsible for pumping blood throughout the entire body. Cardiac muscle cannot be controlled consciously, so meaning like we cannot control by thinking about making our heart beat. So it is known as an involuntary muscle for that reason. The cardiac and the smooth muscles are innervated by the autonomic nervous system, thus being controlled involuntarily by the autonomic centers in our brain. And we also did talk about the autonomic nervous system, if you remember from the first week when we talked about the nervous system, we did talk about the autonomic nervous system and how that controls the involuntary parts of our body, meaning the beating of our heart.
In this topic, in the cardiac muscles, there is a one wonderful cardiac tonic, cardiac toner in our homeopathy that can be, that vibro homeopathy, that is Crataegus. Crataegus is a remedy which strengthens the heart muscle. And also there is another remedies. There are so many remedies, which works on like arnica, bryonia. We'll discuss in the next slide. The arnica, bryonia, there means complete that muscles means complete muscle it will affect, or you can say it will have a positive effect. So calmia is one of the most important remedy, and for that digitalis is one of the heart rhythm. Heart rhythm is formed by the cardiac muscles and the nervous system. So all this will be the digitalis and calmia and Crataegus and so many and even gold, arum metallicum, arum mur, the gold chloride. These are all the things which will help the heart to function well. So we will see different type of the symptoms when we are occurring at this heart muscles due to heart muscles. So in this one, since it is involuntary, you see that cardiac muscles are involuntary muscles. It is not, we can't stop it with our own will and wish. So for this, what is the remedy in our book to control? Of course, we will be studying that the same thing in our circulatory system. We will study that in the circulatory system also. But as a muscle is concerned, heart muscle, it is pumps the blood. So what are the disorder of the pumping of the heart? That is called as a bradycardia and tachycardia. That is slowness of and even these palpitation, you can say increased rate of pulse. So like that we will see. But what is there in our book? That's called as a palpitation. In our vibrionics, we give palpitation. I'll tell what is the mixture number. Palpitation. Heart palpitation. It is written in as a heart palpitation. That is mixture number 57. We see what it covers. Heart palpitation. Any abnormal condition of the heart they are telling. So any abnormal means palpitation means there is a the increase of the cardiac function. I mean cardiac muscle function. So there are, I already told you which all regulates the our heart, or you can say system, or strengthen the heart. That is a distalis, crataegus, spigelia, and heart MGA. Even heart, the organ remedy is also, see, we know what are the organ remedies. Organ remedies are the thought thinking about the healthy functioning of that particular organ. If I say OM heart means you are imagining that heart should function excellently with all its myocardium, pericardium and other thing, everything. So strengthening of the muscles. So like that, it's all thought which we are talking about. Even though when we talk, we think there is a lot of medical things here. But no, we are only thinking about how deeply we can think and put our intention to execute the healing process. So here you can see what are the convallaria is one of the most heart action regulator. You go through volume 3. I think you all have volume 3, and you go through the convallaria and distalis, crataegus, calcarea pos, and symbol and spigelia, calicarp and heart. It's a wonderful remedy. In any abnormal heart condition of the heart you can give. So it strengthens the muscle. So we generally, because this is what is lagging, we will conduct regular seminars on different topic even after completion of this course. Here we are not only concerned about this course, we want that our healer should be able to produce a very good result and able to help the society. For that reason only we have formed the Douglas Therapy Foundation. So we will do our best, but in the same time we'll have a seminars saying that what all the remedies works on one particular topic. We'll take on one particular topic and we'll discuss on that. We'll discuss the vibro-homeo medicines on that. We will also discuss the organ therapy medicines. We'll also discuss the Narayani mixtures, what are all helping into that even after the completion of this course. Because we want to be, our intention should be very focused on that particular subject. Okay. Now let us see. Because of this cardiac muscles, I'm
Cells of the cardiac muscle tissues are what's called striated. That is, they are the muscles are associated with your internal organs. So for this reason, it is also referred to as visceral muscle. The name smooth muscle refers to the microscopic appearance of it because it's very smooth. It lacks the striations of the skeletal muscle and of the cardiac muscle as well. So smooth muscle.
And you know, this is the smooth muscles. These smooth muscles, they form like our large intestine, small intestine, stomach, and whatever all parts of the bodies are formed by this this smooth vessel, they are involuntary in nature, because you can't control, when you are taking any food that it is going through the esophagus, you can't stop it. Oh, don't go down, you just hold there, you can't say and hold it. So like that, they are all involuntary. Yes, there are some voluntaries also, while passing stool and all, even though these are all again connected to the nervous system and through the vertebra. We'll discuss it when we talk about the nervous system.
Is found in the walls of the hollow organs, such as the stomach, the respiratory airways, and blood vessels. So skeletal muscle is the only voluntary muscle tissue in the human body, meaning that it is controlled consciously. So if you consciously see that you want to, raise your arm, that physical action you're consciously, performing, and that requires skeletal muscle. So the function of skeletal muscle is to contract, to move parts of the body closer to the bone than the muscle. These skeletal muscle fibers I think that it's important to talk about skeletal muscle cell structure, since it's, so we have the sarcolemma,
Not required.
muscle cells, so the four main physiological properties of skeletal muscle tissue include excitability, so the ability to detect neural stimuli. Also, contractibility, and contractibility is the ability to contract in response to that neural stimulus. And then there's extensibility, and this is the ability of the muscle to be stretched without tearing. And then the skeletal muscles of the human body are organized into 4 groups for every region of the body. You first have the muscles of the head and neck, which include the muscles of that help with facial expression. You also have muscles of the hip, the thigh muscles, leg muscles, and foot muscles as well. While we're talking about the muscular system, it is very important to talk about muscle contraction. And the most important property of skeletal muscles is its ability to contract. So muscle contraction occurs as a result of the interaction of the myofibrils, which we just discussed. And then the is due to generating enough force to overcome lifting distance being greater than muscle maintained walking down a hill. There are also several types. See here now, you can't rotated it. So forward palm. We have special movements, certain movements that did not get into any of the previous slides.
These are all. See, when you are doing the examination, patient examination, during that time, these are all movements are required. So what are the movements it is not doing? When you are writing the case records, that time you should say that this movement was not working. This movement is restricted. For that reason only it is required. I think so for us it is not required, and we can't differentiate even based on this also.
Lesson was allotted 10 for.
So then your last video, this is about the diseases. Means what are the problems?
Body is made up of many organs such as bones, the brain, the lungs, the muscles, the skin, and the stomach, and many others. And all of these organs are also made up of tissues. Now, something has to hold these things together. The organs and the tissues, they have to be held together by some sort of a glue. What is this glue?
That's a connective tissue.
Hi everyone.
joints in the human body?
Our arms and legs are our appendages.
I'll just say I have recorded one more video that will.
The muscular system and the skeletal system are important for many different types of movement in our body. So you can imagine when any part of these systems is affected, how it will affect our movements, right? So this is what.
This is covering the what are the major major disease occurring in the muscles and the bones.
Our video is about different disorders in these two types of systems. First, we will look at a disorder that affects the neuromuscular junction. So here is a neuromuscular junction. The green things, they are nerve endings, parts of neurons. And the neurons, where are they coming from? From the CNS, central nervous system. So this is the central nervous system. In fact, it's the cross section of the spinal cord. And this is a neuron. The green thing is a neuron. And this is a muscle. So what we are interested in is this, the contact point between the neuron and the muscle, which is called the neuromuscular junction. So what happens is in a disease called myasthenia gravis, the neuromuscular junction is attacked by our own antibodies. So that is an
Yes, recording is already started.
Imagine when any part of the system, this one is this, contact point between the neuron and the muscle, which is called the neuromuscular junction. So what happens is in a disease called myasthenia gravis, the neuromuscular junction is attacked by our own antibodies. So that is an autoimmune disorder. So our antibodies go and attack the neuromuscular junctions. And so what do you think will happen? What happens in a neuromuscular junction? Do you remember? The nerve transmits a signal to the muscle and tells it to contract. So we can contract our muscle.
See, this lack of coordination, this particular complaint is covered under the vibrohomia medicines like gelsemium, plumbum, like that. Plumbum metallicum and gelsemium, they cover this. We had this type of particular patient. Now, when he was slowly, they lose the control over the muscle, and this is the autoimmune disorder. Means our own defense mechanism works on that, and there is no. He was under the heavy the steroids to tackle this problem. But we have some plumbum metallicum and gelsemium and brain and paralysis. We can treat on that way, and also we should address the root cause of this problem. So root cause, where is the, see, we have to make the nerve strong, muscle strong, and we can even go as per the symptoms also.
And we can do different kinds of movement. When the antibodies affect this neuromuscular junction, this communication is not happening very effectively. The neuron is sending the signal, but the muscle is somehow not receiving it well. So what happens is the muscle does not contract as efficiently, and it gets weakened, and that may result in tiredness, fatigue, or even in some cases paralysis. So let's break down this name. Myas means muscle. Asthenia means weakness, which is what we see in this disease. And gravis means serious. So it is a serious muscle disease is what the name tells us. But we'll see later how it's not as serious as it sounds usually. So what are the symptoms? So the symptoms are muscles are weakened, fatigued, and in some cases, paralyzed. I said it's not as serious as it sounds because it can be managed. There is no cure for this disease, but there are certain medications which improve the transferring of the signal between the neuron and the muscle. Then there are some medicines which reduce the immunity. They are immunosuppressants. So management, treat the neuromuscular junction.
Here we have, that's what I was going through our numerical mathematica. Very clearly they have mentioned the neuromuscular spindle, neurons, and neurotransmitters, all neurotendinous ending, and neuromusculoarthritic skeletal system. Like that we have numbers. When we come across such problem, like myasthenia gravis is the problem, where they lose the control over the muscles because of this neuromuscular joint. So, and as you said, there is no cure for this. It's only managed. In allopathy they give the immunosuppressors, so that again they have a lot of side effect and other thing. That is their job. We will say, as per our symptom, what we can do. We can improve the muscular system. We improve the neuromuscular joint, and where we have to focus, because when we are giving a remedy by infusing a thought into water, you should focus on that particular point. Even I tell you, many of the healers, you may be aware of it. If you don't have any remedy, but you with all this background, muscles and joining and even nerves, you assume that the muscle joining, wherever it is there, it is being perfectly all right. This is getting improvement. This will be improved. I request the universal consciousness that this particular problem, to attack this particular problem, or you can say to reduce this particular problem, let the energy come into this water or pill and give it, and it is going to affect, because intention has a thought, has a energy. Another slogan is energy follow the thought. So energy follows thought. Your energy, whatever you are thinking, muscles and neuromuscular junction you want to repair, just pray for this, but let this particular junction be cured. Let this junction be healed. So like that, if you, when you assume, why all this, again I am telling you why this anatomy, physiology and muscles and bones, why it is all required to study? To have a perfect imagination. As vague is the imagination, as the means not so strong, very vague, the imagination will lead into less healing. More perfect imagination, more perfect to the point imagination will lead into healing. Your thought, your thinking, yes, this muscles and muscle joint and there is a nerve, that let that joint be improved. And see, for that, every one of us, we are not able to think in that a deep way. For that reason, what they have done it, they have converted this thought into numerical code. So that when you use that particular code, for example, I am telling you that, neurotendinous ending. Neurotendinous ending is 191619. 191619 is a numerically coded thought for that particular tendon which is connected to the nerve. So when you use that particular number by thinking that you are going to heal, you are going to address, energy will follow there. Energy will go and make the healing. So this is what is the vibronic system. We are only using the thought energy. We are using the intention energy. Since we can't, everyone can imagine in a different way. But if we think in a totality, that is converted into a numeric code. That numeric code, when you use in the machine or when you use the geometrical code like a coded cards, when you use that, so you get a consistent healing, consistent result. Okay, so let us see further what are next disabilities.
And immunosuppressants.
See, here the more thing is there. What we have to treat here, what they are telling, treat the neuromuscular junction and immunity. Here they are talking about immunosuppressor. We have to talk about immunity raising thing, because we have immunity, OM immunity and SOHM immunity, so many things, and even mixtures immunity. We have that. We have to treat in that way. Raise the immunity, make the immunity system strong. Make that immunity system strong. Let that work in a positive way. So when, if any disease is connected to autoimmune disorder, nowadays most of our diseases are autoimmune disorder only. So you have to raise the immunity. We have to guide them to have a very fantastic group. Yes, we can strengthen the autoimmune system by that, and also what we can do with the immunity, we can autoimmune system can also be strong. So here, it is not, see, I understand, Ishaji, you have done a very good thing. Here we are suppressing the immunity, but there we are correcting the immunity. Thanks for your suggestion. Here in allopathy, they are using suppressors, immunosuppressor, because they should not react to that particular problem. So, but here if we address the immunity, it will correct the immunity problem. So autoimmune disorder, we have in our 108cc combo, we have a number for that. I think 12.4 is a number for autoimmune disorder. We can go through that, what all the remedies they are covered in that. We can think it will not increase the immunity, or you can say where it is at, the suppressing is required, very you are correct, but that there it is correcting the immunity. Okay, so thank you for your suggestion.
So these make sure that the person is able to manage the regular movements that he wants to do. Another disease which on the face of it might look similar is muscular dystrophy. Dystrophy means degeneration. So the symptoms are kind of similar like myasthenia gravis. So weak muscles, paralysis, but the reason is very, very different. The neuromuscular junction is not affected. The muscles themselves are affected. You can see the difference. This is normal. It's a normal muscle, biceps in our arm, whereas this has the diseased muscle. You see how thin it is. It's degenerated, and the cause is genetic. There are many types of muscular dystrophy. Each of them is caused by a genetic reason. Actually, this is more serious than myasthenia gravis. It can be, not necessarily. Most people can live a healthy life with some kind of management. Again, this disease has to be managed. It can't be cured. So management by certain drugs like steroids. And then there is physiotherapy. Most people will live for quite a while, but sometimes the disease spreads too soon and a person lives for only, let's say, 20 or 30 years. So yeah, this is more serious, although the disease myasthenia gravis has the word gravis in it, which means more serious. Muscular dystrophy is actually a more serious disease. Another disease of muscles is called tetany. In this disease, the muscles spasm or contract uncontrollably. You have no control on it. So, for example, in these hands, you see these hands have peculiar postures, right? Why is the person holding their hand in such a way? Well, not on purpose. They just can't move their fingers, so they, have more normal postures. Their fingers are stuck in these poses. That's because they are contracting uncontrollably. Sounds painful, doesn't it? In fact, it is. And the cause is low blood calcium levels. So the symptom is uncontrolled spasm of muscles, and the cause is low blood calcium, and it often results from hypoparathyroidism. So what is the treatment? Calcium supplementation.
Here what we'll study, here what we can do. This uncontrolled spasm of the muscles. First of all, we have a mixture called as a spasm. So second one is, it is already known, see, we already know that this is because of the calcium problem. So we have a mixture number 67 to address the calcium metabolism. See, calcium mixer is there. So in that one, what all there? As it was told there, parathyroid, calciferous, calcareous floor, and bone. They are running bone. So calcium in the body, it works on the calcium in the body. Today, lack of calcium in the body is almost prevalent. So strong antibiotic and drugs, while they're dealing with one of the point, destroy another. Overuse of hormone or remove removal of reproductive organs, like hysterectomy, we likely to see that there is a problem in the bone. So during that time they advise the calcium supplements. So here what we can do in our Vibronics, we can use the mixture number 67 and it will balance the calcium, and also we can give the spasm, one more mixture. So also give the connective tissue and the supportive tissue because there are muscles involved in that. So how we can cover up the disease of this type, and we can follow the correct homeopathic repertory, materia medica and repertory to decide which finger is at doing the spasm. For different finger we have different remedies in the Vibronics. Vibronic means homeopathy, vibro homeopathy. So homeopathy, but all we are doing through the Vibronics. Vibronics, we are giving that particular remedy. In a different finger, there's a different remedy. So that how we cover up the whole thing, and generally this calcium metabolism, again we can say calcium rich food we can take. How we can do the naturally with a healer, how we can tell the advise our patient to have a calcium rich food. What is that calcium rich food? No, whichever looking whitish in nature, that is what you call different fruits. You can say, you can even Google what are the calcium rich fruits. You can have that, those you can advise them to take that fruits so that it can supplement. If only if we give the our mixture 67, it may not help because they should supplement. No, all. Yes, some sesame seeds are very good of this calcium what do you call mineral. So you can use that, and see, our team is a very fantastic team. We have so many specialists in our team. One is acupuncturist, one is herbalist, another is a spiritual healer, and astrologers are there. We can definitely take time. I don't mind in discussing about the course and what are done in the course. And even see, I have made a small group of first batch. You can tell me what else I can take and how can I take it. Last time, as you have suggested, we have taken along with the anatomy physiology, we are covering some of the remedy, how we can cover those complaints. Thank you very much. Then we'll see further.
And also vitamin D supplementation. Do you know why? Because vitamin D is absolutely essential for us to absorb calcium ions from our gut. Let's say you have a lot of calcium rich food. If you don't have vitamin D in your body or not enough of it, then your body can't absorb the calcium from your gut. So both calcium and vitamin D are necessary. So these three were muscle diseases. Now let's move on to bone and joint diseases. So this here, again, it looks kind of painful. It's called arthritis. So here what happens is joints are inflamed. So you see this is a healthy joint and this one is inflamed. So symptom, inflamed joint. So what are the causes? Okay, so what are the causes? Old age. What happens in old age is because of wear and tear for a long period of time, you see this blue thing, this is the cartilage between the bones, and that gets worn out. Okay, see here, it's worn out, and that means the bones are constantly grating against each other and hence are getting injured, hence the inflammation. Then there is another kind of arthritis, which is again an autoimmune disease. So there are different kinds of arthritis, and what are the treatments? There are steroids, there are NSAIDs. I'm not going to go into the detail of what these are. You don't have to know. Just know that they help in reduce inflammation.
So you can hear think what the mainstream science is using here for this complaint. They are using for arthritis some painkillers and steroids and the what all this treatment protocol they are following, that you can see, and you think in which way you can make them through your healing, through our combinations. What are all there? We already discussed about it. Bone knees 30, and knees 30, OM knees, and supportive tissues and connective tissues, and Soham infection and fibrin infection, and pain. You give P59, I mean mixture number 59 for the pain and Soham pain, so that what is happening at that particular point all will be covered. And also symptoms. Someone will be better by the motion, someone is aggravated by the motion. So if someone is better by motion, that is initially we start with that. That is a Rustox. Rustox, you can say potency 30, 200 you can give. And we are going to discuss at the end the app. There we will tell you how easily we can come to know about this. Okay. So what I told you, I already covered these things. So you can, with that we will be able to, again here also autoimmune diseases. Autoimmune disease means our own immunity, they reduce the immunity to heal the knees and all. But there what we can do, we can give the immunity mixture to repair the immune system. Not the raise, of course it will raise the immunity, but it doesn't affect, or it can't make you more sick. It will only repair that autoimmune system, or immunity it will improve and reduce the autoimmune problem. So we are already covered in this one.
There is physiotherapy.
Yeah, this is a very, very important one. Physiotherapy. Physiotherapy means we have to make the move. And we have a small place with a 5-floor building. And every someday or other day, because of maybe the improper diet, I get a small pain in my knees. So what I do, if I stop moving, that's it. I keep moving, keep going up and down, do the things and take whatever possible remedies, and next day it become all right. Means physiotherapy in any of this arthritis or any of the bone problem, any of the muscles problem, this is a must. You have seen in previous complaints also, physiotherapy is a must. So you must keep on moving. Go to the physiotherapist, you learn, they will teach you, they are very kind people. They will tell you how to exercise, do the exercise, and keep those things doing along with your Douglas therapy.
And one thing the doctors keep telling, especially the old people, is walk, walk, and walk. So if you see, any of your grandparents or any other old person that you know who is suffering from arthritis, just tell them, take a walk every day. Your arthritis will be in control. Another bone disease which also affects older people more than others is called osteoporosis. So osteo means bone and porosis, as the name suggests, means pores. So if you see here, this is a normal bone, the cross section of a normal bone. And this is...
For this, what we use for this osteoporosis, that means the bone has pores into increased pores. You can see in the above, there is a dense density is more, or you can say the lower one density is less, density of the cells. So here we can use that bone 200 and bone irregularity OM3 and calcium mixture. And also I advise anybody is above the age of 50 or 60, you can definitely use the nutrition, because nowadays we are all facing what all because of what diseases come, because of what all the things, hurry, worry and curry. That's our digestive system. Hurry and worry and tension. Because of all those things, we get a disease. So we have to supplement the whatever the deficiency in our food, and if you are not moving, I mean not doing exercise, and you see with that is in future in this video only we'll come to know that how we can strengthen it. The strengthening by keep on moving. Just you said, when old age people, the only one remedy is keep moving. And people ask me, when can I walk? I'm having a regular walking for 2 to 3 kilometers. Can I walk after this? Then I say you must walk.
This diseased osteoporosis bone. So can you tell me the difference? You can maybe pause or that weakens the bones, and what happens is fractures happen very easily. So what are the causes? One is old age. In old age, what happens is bone is broken down quicker than it can be reformed. So that's one cause. And the second cause is low estrogen in women, which often happens after menopause. So what can you do to treat it? Calcium supplementation again, and of course vitamin D as well. And
now we have understood again what we can do here. That is what bone I 200. There you can see in the what are the, see, you must just blindly don't use that bone eye. You have to go in the bone eye and see what are the ingredient of the bone eye. Even they are using the potentized bone only. So to recover the bone. So what are the, and Hekla lava. Hekla lava is one of the wonderful remedy for the bone growth, extra growth of the bone. So like that, you have to not only just use that mixture, and you should also go into the breakdown. Breakdown means what all the mixtures they have used in that combination. You have to go into it, study that separately in the Materia Medica. So many Materia Medicas are freely available. For example, Materia Medica Light, one of the homeopathic Materia Medica. You have 2-3 very nice Materia Medicas there. You can choose and read about that. So for example, Calcaria floor, Calcaria phos, and even teeth. And potentized teeth, they are using Hekla lava and parathyroid glands, which keep the calcium, phosphorus balance in the system. So we are tuning that, and Pinus and Sylvestris, this is the pine tree, tall tree. No, it is just like resembles the spinal cord. So they are found with a log signature. There is another thing is called as a log signature, which looks like what objects it affects on that. So that is a log signature. We will take that in some other time. So symphytum is one of the most wonderful remedy in the homeopathy, that it is used in the bone eye mixture 200. So here bone eye, it means you see that just whoever is crossing 50 years, and if you start giving bone eye, because here we are not using any raw substance or no substance is used, only thought of that information is used, very without any hitch you can give this remedy. It will cover. And also tell the, what are the diet, not restriction, diet supplements you should take in a natural available supplement. I'm not talking about the medicinal supplements which are available in the shop. No, what are the available in what all this can be done? It is all there is no license required to suggest take tomato, take brinjal and talk like that. There is no license required. You just go through what supplements this calcium, and you can advise that, and we'll take that one of the subject, so that even we'll take another thoughts, means what we misthought, means if any thought something wrong, what the disease it will be created. So how we can come across that, how we can use some affirmations to avoid those created thoughts. We'll use that, you will see in future. Okay, so now calcium mix, bone 200, bone CM, all will take care of the bone. And what are the muscle system, how we can address? Connective tissue, supportive tissue, and the vertebrae, and whatever they are using, they also cover the muscles there. Not only bone, it also covers the muscle. We can do in that way. So osteoporosis is generally, as you said, low estrogen after the menopause. It is a common thing, and some they lead into early menopause by removing their uterus, hysterectomy. After doing that, that they fall low calcium, and the calcium what is provided in the form of the tablet, sometime will not be absorbed in our body, so it will again have some side effects, or that's why we should advise a naturally occurring calcium we should use. Where all we should get a natural calcium? Ragi, ragi is a very good source of calcium. So, and I don't remember what it's called. Amrud is a fruit, what we call in English, I don't know. So this fruit has a lot of calcium. Yes, guava. Yeah. So that guava will produce lot of calcium. Will have support lot of calcium. So likewise, we can advise people, those who are under our supervision, wherever under the sun is already. So we'll go to the next what they are talking about.
By the foot position of joint. And
yes.
Why is inflammation?
Fantastic.
That has a very specific reason in gout. You see these yellow crystals.
So I am very much excited to stop it here only, because we have a wonderful remedy for this. Mixture number 82. Mixture number 82 is for the gout. Means how you should know, how you will come to know that this is a gout mixture 82. So because of excessive of accumulation there, so what you have to do, uric acid and kidney. Excretion is a part of kidney's job. Say their swelling comes, and so when you detoxify yourself by stimulating the kidney, this will reduce. And you can also check the uric acid level. Uric acid level, someone has got a high uric acid level and the pain at this particular point. So you can say that you can use the mixture number 82. And what are the ingredient of the mixture number 82? It's the name itself, gout mixture. Gout mixture, what are the Barberis vulgaris, which works, stimulates the kidney, and colchicum, specific for relieving the gout pain. KBS mixture, which again stimulate the kidney to excrete the excessive the uric acid, and the lead and pal. They are all symptomatic. And again, liver balance, pituitary posterior, and RA mixed pills, and urea. This is urea is one of the homeopathic remedy where we found that it contains all the uric acid level. It has a complaint which covers this gout, and uric acid also we are giving same, whichever is having more we give in the smallest form to reduce that. So Artica urens is one of the good remedy for this, but again all this in our vibronic form, it is available in the mixture number 82. What I tell you, just please go through the ingredient of it, and you will really appreciate. And we have solved many this problems like arthritis, this gout. Okay, so really I'm very thrilled to come to this particular topic.
So symptoms are joint inflammation, cause is uric acid deposition in the joints. How do you think gout can be treated? Medications which reduce uric acid levels in the blood, and anti-inflammatory drugs such as steroids. So to summarize, myasthenia gravis affects the neuromuscular junction so that the muscles can't function properly. They can't contract properly and become weakened and finally paralyzed. Then in muscular dystrophy, the muscles degenerate because of genetic causes. This is tetany, where the muscles spasm uncontrollably because of low blood calcium levels. This is arthritis, in which the joints are inflamed because of old age or because of an autoimmune disease. This is osteoporosis, where the bones are brittle because there is less deposition of minerals and other material. And then finally, this is gout, which is another type of arthritis because of uric acid deposition in the joints.
Okay. Okay, now we'll see. Now we'll study about, we'll just open our PPT and check whether we have, whether we have covered all those things or not. Okay. This is session 2, and all we already studied about the muscles, cardiac muscles, and see example of that muscle contraction and relaxation. We move that, all the muscular system is, there are 3 types. So one is skeletal muscles. They are used for the movement, and okay. So now again we have seen here, we have classified, this is I am going to supply you, and even some other things also I will be sharing with you. You see that, vibrational remedies are which are helping our muscles and skeletal system is already there, and we have covered much more than this also, like gout and supportive tissues, and even everything whatever we have done here, and that's why we have to study, because muscles and bones are attached together. We have to see, and that's why we have to study it together. And one more thing, while, because Dr. Suvarna has pointed out that, when we are studying about the skeletal system, in nowhere that sinus cavities are not told there, not informed, because of course it comes under respiratory system, but when we are studying the skeletal, skeleton, that time we should know the sinuses also. So here where there is accumulation of the mucus and we get a sinusitis. So we have very good remedies for sinusitis and sinus 6x and sinus Soham sinuses and post nasal drip and all that. We'll study that in the deeper level into when we come into the respiratory system. You see, I already told you at some time that the we have 814 remedies working on a muscle. When you go into the deep, there are type of modalities, and when something aggravates from the cold and something from a hot, like that. See, when you have a materia medica and it's available on the internet freely, you can study each and every remedy. So each and every remedy can be studied. Why I listed it here? So just to show that it's a very vast. And if you want to go in detail, we have to study each and every this one. And you see, there are 902 remedies working on the bones. Means different complaint of the bone necrosis, bone growth, or you can say bone decay or bone inflammation. Like that, so many things are covered in this. Right. So now what I did is, mainly the most important remedies working on the muscles and bones. These are, when I take that, I will show you right now with that app how we can filter. I am just filtered out the which are the bone remedies on the 4th grade, means most frequently affecting our bone. It is written in the right side, but with our experience, most of the complaint can be, if 60 to 70% remedies with this right-sided remedy, we can cover all those problems. And you can also see that the arnica, bryonia, rustox, redampa, ruta, symphytum, belladonna, causticum, these are all have that, whatever we studied up to this time, they have those symptoms. So now we'll use some of the app, and by using that app, how we can conclude what remedy to be given out of this 902 or 814 remedies, how we can select on priority by using app. We'll see just within a minute. So I will connect to my mobile to the this Google Meet, Zoom Meet. I will show you how we can operate that app. Okay. Recording. So calcarea phos is excellent remedy for non-union of calcarea phos is calcium phosphate only. So calcium is very much required for the bones, like curvature of the bones. So these are the remedies as per the priority. See, this is the beauty of this particular book. This is the Bishwambar Das book, Select Remedy by Bishwambar Das. This book is also available in the market. And see, caries of the long bone, cracking of the joint, crackling of joint with cracking of the joint, and pain penetrates the marrow. So like that, calcarea carb. So caries of the bone means what symptoms are tallying with this, we can use that particular remedy. See, in this one, if no remedy potency is not mentioned, that means we can use 30 potency. It is written in the introduction of that book, because as I told you, I am using this book since 1987. This is my first book which I purchased for the practice of homeopathy. So
carries of the, we understood what are the bone decay, what are the things, enlargement of the bone without cause. This remedy may be given at alteration with a calcarea phos and other symptoms in the calcarea phos. So calcarea phos and calcarea carb, and these are, see, carries of the spinal cord, non-development of the bones. See, since it is a vibronics, we are giving remedies in the form of the vibronics, so you can definitely give, and curvature of the spine. So acid phos, calcarea carb, silicea, calcarea phos, and sulfur. This is why I am showing this is, I will if someone that when iOS it is not coming, I will provide the hard copy, I mean soft copy of this with a PDF form. You can definitely get a similar things. And inflammation of the bone. So what is inflammation of the bone? First priority is silicea. So if again I tell you, if no potency is written, it is assumed should be taken as a 30. So Stillingia. Stillingia is inflammation of the long bone, femur, tibia, and so you can most frequently used for the knee joint pain is the Stillingia. One our doctor, very old doctor, he's around 80 years old. He is very famous, very I can say frequently used. The thing is frequently used remedy is that Stillingia. Strontium carb, we can say inflammation of the bone, particularly femur. See, they write very specifically. If someone comes with you with a bone, you see, wherever they are showing pain here, they say, I have got a pain here. And see what is there in paining here there. Either is a muscle or a bone or a nerve, or you have to see layer by layer. And so you should cover all those things while giving the remedy. Inflammation of the bone, root injury. See different inflammation due to different reason. Hekla lava already told it is there in the bone. It's a very good remedy for any bone growth. And you find that like gout, you can find some bone growth here and there, unwanted bone growth. There you can use this. Again, and fragile, irregular development of the bone, you see calcarea phos, and you keep going through this, and with this all see bad you can say biochemical remedies can be given in the low potency. Because what is the theory of biochemics? The biochemic was invented by a Dr. Swizzler. What he did is he assumed that all our body disease is arising due to the imbalance of the minerals in our body. So what he did a chemical analysis of the ash of the human ash. ये जलाने के बाद आता है ना पाउडर, जो उसका ash, that they taken that ash of the body and did the chemical analysis. There he found most prominent 12 tissues. With that only, what he says is supplementing those 12 tissues will cure the disease. So that is what is a principle of biochemistry. You can say biochemic medicines in homeopathy that we can also give in our vibronics through our intention. So for example, you see lumbago, backache, cholesynthesis, restox. So I will give you everything. If someone doesn't have it, I will supply very soon after this class. So like that, when you come to the muscles, muscles are incapable of contraction. So I was telling myasthenia gravis, what I told, most prominent remedy is gelsemium. So gelsemium is a most loss of power of the extremities, feeling the knees as if bone did not fit. So like that. Cuculus indicus, it is accompanied by vertigo. If someone is getting vertigo along with this muscular problem, and causticum. Causticum remedy should be tried when gelsemium fails, shortening and hardening of the muscle. It can be felt by hand in hard, rich contraction of the muscular tendons. No, so I think so. So myasthenia gravis, of course. Plumbum is a very important remedy here. So we can go through all this. Already we came to know about myasthenia. So like that we can see here. So we are covered in the anatomy, physiology also. We are covered by the remedies wise also. This is the vibrohomia method. So we'll go back to we'll see just to we'll go to that how we should do in this, how to use that repertory. I told you when already it is there in 805 remedies there. 805 remedies or 902 remedies are there. How we are selecting from that? Is by just going through the find remedy radius bone. Just I put a radius bone. So I got these remedies. So radius bones, how many? 63 means we got a 63 remedies. So like that we will come to know again. And in the radius, pain in the bone, radius bone, like that. See, we will come to know with this. When you go into deep, so all are in capital. Capital letters are the prominently used remedies, most frequently used remedies. So okay. So so likewise, this is the best way. This is the excellent way to go through. I will also share some freeware where you can systematically analyze the remedies and prescribe app as per the vibrohomeopathy is concerned, vibronics is concerned. I'll give you. Now I will end this and I'll come to the last topic of that is how vibronically we can suggest for different problem.
Okay. Now we'll take the now we have seen both this system and this. Now we will take the vibronics, how we can do it. See, this is a very good PDF made by the great devotee of Satya Sai, and which was readily available and doesn't have any copyright. So they have published it for the use of the every healer. I am really thankful to that. I am also want to thank all Khan Academy for giving me that wonderful videos for the arthritis and muscles and bones. Now we'll go through this page number 33. See, I want to take it here. I got some saying that I'm not audible. Is it audible? Am I audible now?
Audible, sir. Audible.
Okay, okay, sir. Thank you, sir. Thank you. Okay. Can you see that screen now? Skeletal locomotor system. Screen sharing is on. So here we see skeletal muscle locomotor system includes spine, joint, muscle, and extremities. So what are our most frequently used the remedies in our vibronics is general rheumatism. We can say arthritis and rheumatism in general. We can use mixture number NM24, SR 310. Yes, recording is started. SR 310 and Restox. Restox and what are the remedies? SR. See, what is this SRNM? I think many of you have my card system also. And card system has got some advantages because there is now less human intervention. Thought imprinting will be very easy. So NM24 SR 310. 310 means see the straight way you can go into the 310 card number and take that will be written as a radium. So if no potency is written in front of that radium, so that means you have to keep the same potency what is mentioned in the card. If more than two potencies are mentioned on the card, you have to see here, see for example, Restox 200C, they are written. On the card, there are two potencies mentioned, 200C or 1M. So in such cases, we have to use 200C and SR221 is heart chakra. Okay. So everything is here, arm pain, shoulder joint pain, Califos, Barbaris, and hand rheumatism. I already told you in the hand while explaining about the skeletal system of the hand. I already told that hand rheumatism and Restox and Caulopilum. Caulopilum is especially for the small joints. So that covers the system, means I prefer you should start with this and with a Bishwambar Das. The select remedy was from the Bishwambar Das. So we'll see what all things are there. Small joint pain. I think you can follow. Small joint pain is arthritis. SM34 means all their car numbers. SM34. I will also provide the Excel sheet for this. You just go to the Soham mixture 34. You will get what radionic rate you have to add in this. Okay. So small joint. See, osteoarthritis, we have studied just now about osteoarthritis and how osteoarthritis, what are the remedies here? Knees, and see, osteoarthritis, knees and menopause. That's already we studied. When you come across the menopause, there is a likelihood of bone weakness. So for that reason, what we can take, you see, I already said NM3, NM40, OM16, OM28, skeletal system, synovial tissues, like that. All these numbers, I will supply you the Excel sheet. With that, you can directly 333 means B Morgan will be there. In front of that, the rate, radionic rate will be there, vibronic rate will be there. That you can set into the machine. And tomorrow I will be demonstrating that machine also. So, how we can set that and make a remedy? So, you all know that because you are already owning, many people are having this system, having the one or either a card or a dial, or you can say both. So, rheumatoid arthritis. Rheumatoid arthritis, again, arthritis, kidney, skeletal, and hysterectomy. I told you, if uterus is removed, and again it creates the rheumatoid arthritis, weakness of the bones. For in such cases, you can use this. So, bone decalcification, fantastic. So, we must thank those people who have done this wonderful job. So, bone decalcification, what all we should use? Bone. Bone is the entire bone and parathyroid. So, ankle sprain easily. For that, it's very easily given. So, but just go through and I shown you how difficult it is when you are following the vibro homeopathy, and the same time how beautifully and how easy it is to use when you are coming across the vibronics mixtures when you are using it. Knees in general, injury, for this we have to use this. Water on the knees, those synovial fluid and this, everything we have a remedy here. Leg pain, persistent, and small joint pain, sole and palms burning. So everything is covered in this, and wrist in general. Carpal tunnel syndrome. So what is that? It affects the wrist area. So you get a severe pain. For that, what we are suggested here, hand rheumatism, calcium phosphate, hypericum, because nerve also involved here, and ruta. We saw there in the list of remedies, and supportive tissue, connective tissue, if needed, inflammation. If it is red and painful, you can add the inflammation also. Okay. Then so this ganglion is a word. Extreme means excess of growth of any bone. For that, what all is, and it will be very painful. Just like what happening in the gout, if it happens somewhere in the wrist and hand and that area, it also have a similar symptom. So here also we are using the benzoic acid, ruta and calcarea floor. And one more thing, if you can add one or more remedies. Swollen wrist. For this, what you have to do, use simple, very beautifully explained here. Fracture in general. For reunion of the broken bones, you can use these things. See again, fantastically covered. So it covers almost all the complaints of that. Fractures, gout, we already discussed that. KBS, liver, gout mixture, Artica urens, benzoic acid, and now you can very well visualize what the gout means. What we were telling, what was that gout we are telling. So it was great toe, we saw that swelling and redness and the thing, painful, that is gout, and this is a gout combination. And hips in general, sciatica and sacral and lumbar, and mastoid inflammation, jawbone decay. It covers all bones and muscles, whichever, muscular dystrophy. We saw that muscular dystrophy there. Dystrophy that is decaying, I mean reducing strength, and in mass also. Muscle mass is reduced. For that reason, what all I was telling that gelsemium, causticum, you see, plumbum metallicum, fantastically designed. So, if we are fortunate to get such patients, definitely we can help them in a spiritual way. Osteoporosis, fantastic one. So you give osteoporosis in general. Why? What is I said it's due to old age that won't become porous. For that time, you can use these things. Posture out of alignment, injuries and strains, all strains of a body. Sciatica, shoulder in general. I already told you, you can use the right shoulder is there. You can use the right shoulder, left shoulder. See, it's already mentioned here. If right shoulder, this one. If left shoulder plus left shoulder. So right shoulder pain, left shoulder. I mean, right-sided pain, left-sided pain is there in our mixture. You can use that also. Sole of the foot, plantar fasciitis. See, wonderful thing. Inflammation, injury, alumina, barbaries, and calcare carb and alloy. Along with that, we have remedies from, because these groups are formed by card system. So they are limiting to only 650 cards, or you can say 576 cards. But we have more. We can use numerical metri medica and plantar fasciitis, like calcaneal spur, like that. Those things can be added to this. So, back pain in general. So, if we give this back pain entire, these are a wonderful thing. This I will be sharing just after this class. You can go through the musculoskeletal system, and also you can read in advance the other chapters. So you can, if I forget to inform you, forget to tell you, you can remind me there. So see, beautifully, you have seen where is the coccix and part of the spinal system. Lumbar sacral, that we have seen the lower part of that, where what all things will help in that area is if someone has got a problem. And we have seen wonderfully it is helping. And muscular system, we already covered. We have in most prominent remedies. Muscles, if you have to give as a supplement, muscular pain, nerve involvement is anywhere there, you have to use this. caliphos and hypericum, and we'll also see when we study the nervous system. Small of the back, slip disc, and thighs pain while walking. You have someone like this. So beautifully it is covered. Other than that, other than this, most of, as for me, 90% of the problem can be solved by using these remedies. So I think so. You are all getting very much interesting in this, but I myself while teaching I am getting so excited that whatever it is covered in our anatomy and physiology, directly we can connect to these remedies and get the remedies, get the help, get the support out of those things. Okay, I think so. We'll stop here and I will ask, is there anything I can tell you, anything you want to know more, or anything I want to improve on next classes? And as already told you, we will be demonstrating a machine which I am giving, means almost discounted rate with this course only. This will be only given to the course participant and no one else. But you already have it. If those already have it, if they can have one additional one, definitely they can have it. But it's actual, it will be worth more than 4 times worth than what it is. Tomorrow I will be showing it. So we'll demo how we can use it. And see, anything else, please come, sir. Ravi, sir. I think so. It was very. Am I not burdening you too much? You have to go through. You have to go through. I understand this because we come. I'm into this field since 1987. So all words are very familiar to me. So you will also feel very, once it's a beginning, and definitely you will come to know, yeah, this every part. Now, first of all, very nicely we are understanding the volume 3. Volume 3 has a treasure. So earlier I never thought, oh, supported tissue, connective tissue covers so many parts of our anatomy. So like that. So sir, if you have any suggestion, please suggest me in person also, if you want to, so that it can help to other people, and we will make it a great journey, sir, because we will be able to tackle all this. And I told you there are so many freewares, free homeopathic software, which I will be suggesting you that how you can diagnose, how we can, homeopathically, how we can categorize, how we can select the remedy, and how we can do that remedy in the vibronic form. Very soon, when next coming day, we will take it. Okay. And Ishaji, please. Ishaji is there?
Yes, sir. Yes, sir.
Yes, madam. Any suggestion? As thanks for your suggestion in between, because that we were allopathic doctors were trying to suppress the immunity. We are trying to correct the immunity. So very thankful.
Yes, because sir, I already I'm working with someone who is suffering from autoimmune, like multiple sclerosis kind of situation where the allopathy doctors are suppressing it, and we being into alternative medicine, we are helping to strengthen the immune system. So he was basically confused in that sense. So that is why I was looking for clarity in this, that we have to basically balance the nervous system. Whatever is required, whatever is missing, that has to be suffocated with the remedy, so that it should be in balance, in harmony with the person, right?
Yes.
And secondly, sir, with this, I think, as you said, the volume 3, that is becoming more understandable, because we were also overlooking many things. We were just focusing on the rates and infusing them, in the globules or water. But getting into the theoretical part is making us emphasize and go through the parts, the
Yeah,
medicines that are included. So that makes sense to me, and
correct.
I will be also looking forward to more like this kind of
Sure.
explanations.
Yeah.
Thank you, sir. Thank you.
Okay, ma'am. Rajeshwari madam, thankful. Thank you for your all patience. So, lot many people are very busy. They are requested me that they will be going through the our recorded version, and it's already there. In the beginning itself we made it clear, but you know, with you all, I become more active and proactive. So I think so. I am taking it very nicely. I myself become very enthusiastic, excited to see all those parts and connecting all those parts with the volume 3. And
Fantastic class, sir.
yes, Rajeshwari madam.
Very much interesting. Fantastic.
Yes, ma'am. Thank you, madam.
Sir, please do share the videos also with us that you shared, because I think we missed many parts because it was too much for one time. So
Yeah,
we will
I understand that. Yes, we will share that.
Yeah.
And
After
Hari Sachin sir. Har Sachin sir. Okay, we think busy. Ravi sir, tell me.
sir, after few sessions, let us have some homework, sir. Some important disease and how we have to cure. We can have some group discussions, and that will be more helpful in that.
Yeah, definitely. Now, see, your homework is that today's whatever volume 3, volume 3 is fine. I'm just going to share you remedies and useful combination,
Okay,
which I took at the last. That time you have to see from the musculoskeletal system, that system, what all it is necessary for you. Musculoskeletal system, what are topics are very important, what all it means. If you don't understand, we'll sit together and we'll discuss. Okay. And wonderful thing is it is most easily we can tackle. We can make even one remedies, group remedy, and make it ready. Make those things ready. Yes. So that okay, someone is coming with a sciatica, you can directly prescribe based on sciatica. And sciatica, of course, it comes under our nervous system. So we will talk about what is that, and nerve, sciatic nerve is there. We will take about it. Thank you for your patience. And I know, because even my Dr. Suvarna was telling it is too heavy to listen, but we have to cover this. This week was that only. So tomorrow we'll see the nervous system. So it's very easy, and how we can. Thank you very much. Thank you very much, sir. We'll conclude today, and thank you for your attending this class. Thank you, sir.